Hello, YouTube. This is Ashley. I apologize for my ghostly color. We're having some issues with lighting. I promise you I'm not that white. But anyhow, I am coming to update you after my 1 week post-op appointment with my surgeon's office. This week has been good, but hard. I still have been in pain. Been taking my pain medicine. I've been on clear liquids until today, and today I reissued the protein shakes with milk back into my diet, which is nice, and it's a switch up from all clear liquids. I can also have yogurt and some other things that I haven't tried yet, but hopefully we'll try tomorrow. So the big news first is my numbers. Before surgery, I was at 337, and as of today, 7 days post-op, I am 327. So I've actually lost 10 pounds this first week, which I am absolutely thrilled about. The surgeon's office was very pleased with how my progress is moving along. My incisions look great. I haven't had any out of the norm problems other than a very large bruise, which has to do more with my blood count, which we're going to investigate, and I have a primary care appointment for on Friday. But overall now I have lost a total of 45 pounds. I have never lost that much at one time in my life. It is definitely a major accomplishment for me, and I am so thankful for that. I have started to reach the point in my life, in this stage of the journey, in the weight loss journey, to where I have to do a double take in the mirror. 45 pounds is quite a change, and there's sometimes when I have to look again and be like, is that me? You know, it's like I don't recognize myself. And I've heard many others say the same thing, and I've also heard that it takes your mind longer than your body to catch up with your weight loss. And I can definitely see that, because that's how it's been with me. And a lot of people that I know and work with have been commenting on how they can definitely tell, especially in my face, of that I'm losing. And truthfully, I'm not getting very many calories in a day, which maybe between 300 and 500, but I'm not hungry. And I'm making sure I at least get my 70 grams of protein, which I'm thrilled about, because I know that's what's most important. I did kind of have a scare last night, and maybe some of you out there can relate to me. I feel like I don't really get a lot of comments, so I don't know how many of you feel. I'm hoping that you'll comment and post what you think about what I have to say and give me your input. Last night was the first time I have had cream soup since surgery, and I had cream of broccoli. The first mistake was it was way too hot, and I actually burned my esophagus. My throat is extremely red, almost blistered, and it hurts to swallow. So that's no fun. Note to self, make sure the soup's not too hot before you try it. Second of all, it was probably, I don't know if you've ever seen the Campbell's to go soups, probably about that big. I had almost a half of a container, and by that point I was starting to feel full. And when I say full, I mean fuller than I've been with anything that I've had since my surgery. And the problem is my mind kept saying, oh, this is good, eat more. But I could feel the stomach. I could feel my stomach saying, no, that's enough. And I scared myself because the fact that in my mind I wanted to push past that. I know that's what got me in this place. I know that's what got me here in the first place, is overeating, eating too much when I'm full, and I don't want to do that again. And I was actually fearful of eating too much and doing something to my pouch with the liquids, or drinking too much liquid. And I actually talked to the surgeon's office about it today, talked to a nurse practitioner, and she said that right now the main thing for me to focus on is what I'm eating. When it comes to the liquids, it's not necessarily quantity, it's what. Like if I were to jump to chicken or something way ahead of schedule, then it would cause a lot more problems. But with soup, or as long as I'm sticking to what it says, it shouldn't be a problem. And that as long as I stop when I get to that point, I'll be okay, and not to be so fearful about it. Have any of you had a similar experience? I feel like I am paranoid of breaking my staples open, of ripping my stomach open, and all I've had is liquids. I still haven't had anything solid. Normally it's small amounts at a time. I haven't even been able to finish a whole cup of Jell-O yet at a time. But when I get that full, satisfied, uncomfortable feeling, it always scares me that, am I eating one bite, 2 bites too much? Is this going to hurt me? Am I the only one that feels that way? How do you all feel about it? And how do you handle it? Something else is I have become obsessive with my scale. Not only have I been weighing every day, but I've been weighing several times a day. And I know how bad that is, and I never plan to do that. I've always planned on doing it once a week, but here lately I've just been obsessed with seeing the numbers come down. So I'm actually going to have my husband keep the scale in the attic and get it out for me only on my weigh-in days, which are now going to be Tuesdays because of my follow-up today. So I won't weigh myself again until next Tuesday, and then I'll do another video update then. And hopefully I will stay motivated and not be too focused on the actual numbers. That's been my biggest challenge so far. And also cravings. It's not that I'm hungry for anything in particular, but I live in a house with 3 other people, my husband and my 2 sons. And my husband made a homemade pizza last night. And it smelled so good, and it looked so good. I almost felt like it was just torture. Here I am drinking cream soup and clear liquids, and they're eating pizza. And deep down I know that the sacrifice is worth it, but it's the smells. The smells has been hardest for me. If I'm near a restaurant, or I'm at a restaurant with my family, or even if they're eating fast food and I smell what they have, it triggers those cravings in me. It triggers those desires. And obviously I haven't given in, because I won't, but it still makes it hard. And I also talked to my practitioner about that today, and she said that that is perfectly normal and not to worry about it. That I eventually will be able to eat pizza, but just a small amount, and that when you're on the liquid stage, it is the most difficult time because you can't really eat anything. To just remind yourself that it's all going to be worth it, and that you will get to have what you want eventually. So anyway, that's my update. I went a little bit longer than I thought I would. I'm down 10 pounds first week post-op, total of 45 altogether. I've went from my highest of 372 down to 327. I have not weighed this amount in about 6 years, so I am thrilled to see it. Can't wait to get down in the 200s. I know it's not too far away, and I will post an update again, but I really would appreciate your comments and suggestions. How do you deal with cravings? Do you have cravings? Do you have fear of ripping your staples out? How do you feel about the liquids? What are you doing? What's helping you? I hope to hear from you soon. Thanks. See you later.